Hello, my name is Shelby Miller, and the purpose of this video is to gain your support for a policy I have developed called Providers Education on Controlled Substances Policy, or the PECS policy, PECS. There is a huge gap in our healthcare system when it comes to aiding those caught in the chains of substance abuse and addiction. This is a clinical practice issue and a public health crisis, with many in our government naming it an epidemic spanning our entire nation. In the United States, there's a steady and rapid influx of drug and alcohol users. For example, in the state of Utah, where I'm from, between the years 2000 and 2014, Utah experienced a near 400% increase in deaths from the misuse and abuse of prescription drugs. Substance abuse in the U.S. totals more than $700 billion annually in costs related to crime, lost work productivity, and healthcare. The purpose of the PECS policy is to aid in effectively reducing the rate of substance abuse in our country. From 1991 to 2011, there was a near tripling of opioid prescriptions dispensed by U.S. pharmacies. With this increase, there was also a near tripling of opioid-related deaths over the same time period. Who are prescribing these? Is there adequate education before a prescriber is able to give their patients access to these potent medications? Let me tell you about the policy being proposed. The PECS policy is a national policy, which would require 12 hours of online free educational training on the brain disease of addiction for any and all providers who will be prescribing opioids for any reason. This training would review the CDC's guidelines for prescribing opioids for the treatment of pain. It would also review patient assessment, treatment planning, psychosocial services, staff roles, diversion control, and training on utilizing doctor shopping databases. Along with the initial 12 hours of training, every year providers must complete an additional 2 hours of continuing education regarding any updates on addiction studies, prescribing techniques and cautions, medication changes, etc. The main goals of the PECS policy are to empower prescribers to be more confident, yet cautious in their prescribing abilities when it comes to controlled substances. And the policy ultimately has the potential to positively impact our healthcare system and save thousands of lives. An added benefit of the policy is that it also has the potential to save the United States millions of dollars, simply due to the fact that substance abuse costs our nation billions annually. In 2013, 249 million prescriptions were written by healthcare providers. That's enough for every American adult to have their own bottle of pills. In 2014, 28,000 people died from opioid overdose, with at least half of those deaths involving a prescription opioid. Clearly, there is something wrong here. I never want to see one of my patients harmed due to a medication that I have prescribed. Because of that, as a nurse practitioner, I will gratefully participate in any additional training regarding the brain disease of addiction. If the PECS policy is passed, all providers who prescribe controlled substances would be made aware of the situation at hand, rendering the benefits of this policy insurmountable. Thank you for your support.